We are using Bühner's protocol to treat our daughter borreliosis. And we are using cat's claw, Japanese knotweed, cordyceps, angiographies, the ones that we were able to find here in Lithuania, rhodiola, ashwagandha. We are using encapsulated root powder. Is it okay, or we should switch to meters?
No, it's okay.
Because we are using them from June, and I thought I saw improvement in August, in the end of August, but now the symptoms reappear again. So I'm thinking about changing something. Of course, we have not done the things that you mentioned. First, clean the colon, yes, clean the liver, kidneys. Maybe it is associated with that, so that it seems that sometimes it is working, Bühner's protocol, and sometimes not.
Right. Yeah, you have to do all of the foundation work before you start killing. Because if you're using antimicrobials, like Bühner protocol, there's nothing wrong with the protocol. It's the timing of adding in the protocol. Maybe it's too early to add in the protocol. Maybe there's more work to be done, like you said. You have to clean out the body, do some foundation work, look at the gut, and then you can start adding in the end. Look at the hormones. Is the body even able to repair itself? What is happening? Because looks like your son, right?
Daughter.
Your daughter. Looks like, I don't know if you're aware, but all of these co-infections have a monthly reproductive cycle, right? So the herbs are able to keep it down for a few months, but then it seems to be growing back. So why is it growing back? There has to be a reason for that. I mean, I don't think she's getting reinfected every few months. So why is it growing back? That's what you need to find out.
Okay.
That would be the important part.
Okay, thank you.
Okay. Anything else?
Would you be willing to share the names of the 11 herbs and 5 supplements that you enjoy most?
That I am currently doing on maintenance? Yeah, sure, but it would be irrelevant because for me, based on my symptoms, my experiences, my muscle testing, right? So one other thing that I do with herbs, and I'll give you the list. One other thing that I do with herbs is for chronic patients, what we call in energy medicine is imprinting, frequency imprinting. So frequency imprinting is done for all chronic patients. So those herbs resonate with that patient, right? And I also practice spiritual herbalism. So all of the herbalists that I get the herbs from, practice the same. So that increases the potency of the herbs as well. So the herbs that I'm doing, let's see, I'm doing cat's claw, biocidin, bidens, knotweed. I'm doing pasque flower. Yeah, I'll give you a few, not all of them. Right, medical confidentiality, but okay, I'm just kidding. Okay, so where was I? Pasque flower, bidens, knotweed, cat's claw, hutainia. It's very interesting, a lot of people have difficulty saying hutainia. So I have one patient that says hootie tootie. It's very cute. I won't forget that. So, so hootie tootie. What else? Biocidin, I said I'm doing. I'm doing a combination a wonderful herbal formula for protozoa that I feel I have to do like, once every few months. So currently I'm doing the formula PZ, it's called as. Then I'm doing chlorella, vitamin D. I'm doing very high dose curcumin, anti-inflammatory. I'm doing an Ayurvedic hormonal support, not hormone, immune support. I'm doing Ayurvedic liver support. I'm doing bioidentical female hormones. That's about it. That's about it. And when I travel, I do a compounded herbal spray for my sinuses when I travel. So. For the flu season, I use a homeopathic flu vaccine protocol. So that's what I'm doing right now. Yeah, I have to stay on top of this because, patients that come to me are infected. So one thing that's important that I've learned through my meditation and spiritual exploring is try to get rid of fear. There is either love. See, there is universal truths is what I've learned. And some of you might subscribe to the idea or not. One universal truth is unconditional love, and the other universal truth is fear. They both cannot exist together. If you have unconditional love for yourself, I love my Lyme disease. I love my Borrelia. I love all of my infections, all of my mold, all of my genetic abnormalities. Unconditionally, I love them. I am what I am because of that, because of my internal zoo. I don't have any hatred and I don't have any fear. Fear was hard. It's hard to overcome. But, spiritually speaking, when you take away the fear, when you become fearless, it creates it creates an energy shield around you. It creates an invisible shield. And that is something that away from you. So minimal preventative, and you're okay overall. So if you are able to love yourself unconditionally, everything about you, and if you are able to take away the fear, then it's a step forward for everybody. Same for your children. It's very hard to take away fear from your child. I'm still struggling with that. I'm not fearless, not yet. But it's an important step. As much as possible as you can be. It's an important step. I'm sitting here today, I've clearly been exposed to different toxins that I haven't been exposed to before. I'm not saying you're toxic, I'm just saying, it's a new country and I've been exposed to it. So I was very happy that I got a fever. I mean, I've had a fever for 2.5 days now. I have a fever now. But that's great. I mean, it shows that my immune system's working. So I'm okay with that. I'm still here. I haven't run away yet. But yeah, I'm not afraid. It's okay. I have so many doctors here if I need.
Can I ask about diet?
Sure.
You mentioned about frozen food. For example, our family uses a lot of berries, organic or vegetables, frozen one. Why not?
No, I meant frozen processed food.
Okay.
Yeah, fresh berries, frozen berries, those are okay. But yeah, the processed foods, even the organic ones I wouldn't use. Because you'll see, I mean, it's not for everybody, but if you're really, really severe, then you'll see that things like, they are mislabeled, the organic, right? If you want to Google what would you Google? The hidden sources of MSG. You'll see, yeast extract and autolyzed yeast and rubbish like that is in many organic products. And it's labeled as natural flavoring. The heck is that? Natural flavoring, that's just. So we kind of stay away. I've trained my son as well to look for those things. Once in a while it's okay as a treat. Like cereal bars will have natural flavoring, but we were so severe that I wouldn't like to go back to that if I can help it. And more so out of respect for my body. I would rather not eat than eat that. So. Okay, am I off the hook? Oh, one.
What do you think about coffee enemas for detox?
They're good.
Good. And how often you can do that?
Once a week, once a month.
Okay.
It depends on how you tolerate. Once a week is also fine. I have many patients use once a week.
Mm-hmm. Another question, is it enough to get glutamine from bone broth? Or
Yes.
It's enough, yeah? And what is the therapeutic dose for probiotics? I mean, 5 billions or 10 billions?
No, it's going to vary again.
Okay. But
Yeah.
what is the minimum dose?
I have no minimum, no maximum. No, I do very customized. I've had patients that take 100 billion 3 times a week.
Okay.
If you're very chronic, right? It's a very powder that I get made, and they have like a really tiny scoop that they use 3 times a week. It works. Put it in juice, and you're good. And then there are patients that are not so severe, that use maybe 20, 30 billion a couple times a week. It's, unless you're doing antibiotics, everyday probiotics is necessary.
It's enough from food to get, yeah, probiotics. So is it enough to get probiotics or prebiotics from food?
Prebiotics is not necessary. I rarely use prebiotics, because people are on a good diet with me already.
Okay.
So if you want prebiotics, eat your probiotics with half a banana. There you go. You have a prebiotic. Or if you're putting the probiotics in apple juice, you have, all organic, so you have your prebiotics. So I don't prescribe prebiotics.
Yes, because most of the time, FOS is included in probiotics. I mean, prebiotics already. Inside.
No, not in the ones I use, no.
Okay,
Sometimes they are, yeah. Yeah.
thank you.
Okay, good. Those were not many questions, so I did a good job explaining. You again? Okay. Just kidding.
If President Trump were to name you head of the FDA,
What's
What-
that?
if President Donald Trump were to appoint you the head of the FDA, what would be your cannabinoidal policy?
I am cannabinoid certified. So cannabidiol is already legal in all 50 states. Cannabinoid would also be the same for me, under care of certified cannabinoid practitioners, it should be legal in all the 50 states. It's really sad that it's not.
What would be the limitations you would prescribe?
What do you mean limit? What? I would make it available in all the 50 states, and then the dosage is going to be dependent on your practitioner, right? And anybody with any pain, chronic illness, pain, inflammation, seizures, autism, there's research out there. I mean, has an endocannabinoid system with the CB1 and CB2 receptors. So it's not like you're adding in, opioids with nowhere to go. So of course there's always pluses and minuses, but yeah, I don't see any reason for it being used in all the 50 states in the hands of responsible practitioners.
And what would be your policy on prescription opioids?
The guy is a troublemaker. Okay. there is no policy with respect to opioid prescriptions. You know, like I said, it would be great to have it legal in all the 50 states, and it would depend on who your practitioner is. You know, if you have a certified practitioner, if they are educated enough, we have many in the US that are amazing. I think they should have a free hand in helping people. I mean, you know, it's always good ethics is always you look at the will of the patient and you look at the best information you have. You present the best information to the patient, let the patient make the decision, and both of you work together. So that's the policy in my office as well. You know, I don't dictate protocols. I give responsibilities to the patients that you have to monitor your own protocol, make sure you understand your body, and if any ups and downs, I need to know. You know, you can't just blindly take the herbs I tell you to take. So it has to be a collaborative effort.
Okay. The same question. Is CBD useful in treating Lyme?
Yes.
Useful.
Definitely, yes, yeah. It reduces Herxheimer reactions. It helps to reduce inflammation. Maybe 1% have the opposite reaction. So I use, you know, CBD suppositories for bowel inflammation. I use topical cream, right? Topical CBD, and of course I have these very strong, well, you know, your regular available on the internet CBD oils, right? These are available to practitioners. They're industrial strength, which I use, and they work very well. Yeah. What is the regulation here? Even CBD? Okay, CBD is allowed here.
No, not. Since maybe since New Year, it is not allowed it anymore. In the supplements.
Really?
As far as I'm aware.
Okay, that's a shame though. I mean, if you have very low THC levels, well, you know, Israel is doing wonderful research on, I have one patient who is using a really good formula, good ratio THC CBD for his son on the spectrum. So, but you know, wonderful family, you know, she found me through one of my radio interviews, broadcast, and she, you know, understood complex autism that I talk about, and she's like messaging me everywhere, LinkedIn, Facebook, you know, please help my child. I think he has complex autism, and you know, so now I have them. We had them by Skype, and they're doing well. I mean, yeah, she was right. She was right about her son. He's very intelligent. He's already 18, with almost nonverbal, and he has complex autism. So I'm sure we can, you know, get him better. Maybe not 100% because he's already 18, but we can see a lot of improvement. Yeah, so his mother was right. So now he's doing well. So now she wants to get treated as well. I'm like, that's right. You know, the mother is the heart of the house. You have to make sure that the mother is really well taken care of. Yeah. No, I just met them. Yeah, he's already 18. Yeah, she's done everything for autism, all the major 5-star doctors around the world.
Because we usually carry this information that it is how it is when it's already 7-8 years old, it is too late to do something.
No, it's not.
That's
7,
why
8 is nothing. I mean, 7 years is when I discovered my son had complex autism.
No, my kid is already 13 years old, and
How many?
13. And
13?
Yes.
It's fine.
And I already done a lot of things, and I see a big improvement, especially with detox and essential oils.
Yeah. Essential oils are good. Not for everybody, but they're good.
It's good for us.
Can I ask a question? What do you mean by talking complex or what
Look,
kind?
I would say Google me, and you'll see what I talk about. It's my work. It's my pioneering work for a few years now, about 4 years, since I started, since I came up with the label complex autism. It's not regular. It's my trademark, and you'll see that's pretty much what I talk about, is complex autism. It's not just your genetic autism. It has many layers to it, and if you start peeling away the layers, you see the child emerging. So you may have a child that has both, and I'm going to talk about this tomorrow if you're here. Okay, time for a break now.
CBD heals and cures, or it just alleviates the symptoms?
CBD, there is no cure in one substance. There is no one substance that cures
But
anything.
it helps something it cures
CB
some
Yeah.
small.
Yeah, CBD in my practice reduces inflammation. That's what I've seen, and the topical application helps to heal. If there's rashes, like when you treat parasites and yeast, and sometimes there's a lot of eczema and rash that comes out, as the body is detoxing. So CBD oil, the strong ones that I use, helps with that.
I think we have 18% CBD oil. What is the maximum dosage for child?
I don't have any established dosages. I go according to each child. It has to be, my first evaluation is 2 hours. It takes time to get all the information and then come up with everybody will ask me a standard protocol. I don't have any standard protocols. I can educate you. I can help you decipher the labs. Many doctors from across the world will book my time and say, "You help me with the patient." And then we just go over the patient, the charts, and see how I can help it. But it's very different from one patient to another.
Okay.
Right?
Noriu paklausti dėl detoksikacijos. Paminėjote, kad galima aromatinės esencijas, aroma oils for detoxification.
Okay, so he wants to know about essential oils. Can somebody translate? It's easier for me.
She's translating you on the...
Paskaitos pradžioje čia po pietų paminėjo, kad detoksikacijai galima naudoti aromatinius aliejus arba esencijas. Norėtume plačiau, jis sako, kad galėtų išvardinti, ką galima tam naudoti.
I don't use essential oils for detoxification other than the ones I mentioned for the bath, right? For the Epsom salt bath, I gave you those options. Yeah. I don't use essential oils orally either. I use them for topical applications. I use them on the acupuncture points and acupressure meridians in the body. Sometimes I will use them right on the organ. For PANDAS patients, one example would be the blend of essential oils I would use would be, it's called as thieves oil. You may have heard about it, thieves, right? So we use organic thieves. The organic version is called as King of Thieves oil. And then I also use a couple other oils depending on the case, like oil of oregano. So I would put like maybe 5 drops of essential oil in a carrier oil and then rub it right on the tonsils or the belly or on the bottom of the foot. right? Bottom of the foot is important. It helps to bring down fevers. It brings down motor tics. So bottom of the feet is where your whole body is represented, according to acupuncture. So that's very helpful. Some acupuncturists use auricular therapy, like around the ear is also where the entire body is represented, according to acupuncture. So that is something essential oils can be used for as well in that area. So, but be very careful. Always do a sensitivity test with essential oils, right? Some people are very sensitive, especially those exposed to mold. So be careful.
Aliejaus, tai čia yra eterinis aliejus, kuris susideda iš dobilo, citrinos, cinamono, eukalipto radiata ir rozmarino. Jisai, taip, Young Livingo. Tai vadinasi Young Livingo, Thieves, tai Thieves. Dobilas, citrina, cinamonas, eukaliptas radiata ir rozmarinos eteriniai aliejai. Informacija. Čia, kur greit radom, dabar nėra gvazdikėlių. I just gave details about the thieves.
Jeigu galima, aš dadėsiu. Čia jis atsirado tada, kai 4 ar 5 į maro metu vogė, plėždavo butus, užsidėjo kaukės, prisilašindavo šito aliejų, buvo pagauti, jiems turėjo nukirsti galvas. Ir jie išdavė šitą receptą, jis yra išlikęs, užregistruotas 1500 kažkurie tai metai. Ir Youngas Livingas atrado tą receptą ir padarė. Reiškia, jis praktiškai veikia ir tai, ką jis pasakė, dėl kad pelėsiam jautrus, padeda tikrai prie grybelio labai, labai efektingai. Ir mes jį naudojam netgi perus.
Okay, good. All right, let's take a break. And we'll be back with pandas next, right?